our physical health, right? So many people nowadays, like since I started my own clinic and even way before that, when I just graduated, we see more and more young people coming up to us for physiotherapy treatments. And why is that? Because most of the time, um, you know, nowadays especially, we use a lot of gadgets, our phones, computer, and whatnot. And due to that, a lot of things is going on to your body, all right? But you may not be aware of that. Yeah. And until it hits, then it really give a lot of trouble, especially in terms of pain and all that. Yeah, it really affects the quality of life. So let's move on. Let's see. All right, so a little bit introduction about me. So uh am inspired to be a physio since I'm from four. At that time, I was thinking of whether to do psychology or physiotherapy. And when my mom introduced me about more about physio, I think that this is my go-to because I get to treat patient. That's one. I get to talk to them, know more about them, and then I can see results if I do well. Yeah, yeah, and that is very satisfying. So that's how I uh fell for this job, and I like it so far. Yep. And I graduated from INTI. We studied 4 years of clinical, 4 years of degree, and I also had 4 years of experience counting up to today lah. And I co-founded Ease Physio Rehab. We are situated at Setapak currently. We have only one branch. I co-founded with my partner, my girlfriend, Yi Zhuang, who is also from INTI. So, yeah, both of us love this profession and would like to treat more people and help more people with their physical health. Right. So this talk is for you if you work in front of computer all the time. I think which most of us can't avoid computer nowadays. Most of the tasks are done with computer anyways. Yeah. Secondly, if you use your phones and laptop for more than 30 minutes daily, I'm sure also very hard to avoid. And like even today's talk in the Zoom meeting is more than 30 minutes already, right? So I think everyone will kena this one. Thirdly, if you want to prevent injuries and you want to boost productivity, of course, right? With injury, we will severely slow you down in terms of your productivity. I think in terms of even physical activities like sports or even your work. Yeah. And lastly, if you are ready to take better care of your body right now, I'm going to give you the exact tools you need, all right, to maintain, to prevent chronic injuries, right? Now, who do you want to look like in your 70s? I'm sure nobody wants to be like, what the guy on the left looks like. Sad and depressed, sitting on a wheelchair, immobile, no strength, can't help himself, to go to toilet, whatever, right? Now, whereas the right side, we see someone strong in their 70s, still working out, still rocking it, still lifting heavy, right? So active, he can do everything on his own, independent, strong. Who doesn't want to be like him, right? Now, everybody can achieve a strong body, but of course, we can't compare to Arnold, right? Like, uh, he's next level, but never mind. We just want to be strong, even when our age catches up, right? Okay, so I have a simple question for you guys. Okay. Is neck or back pain normal? Okay, when you're working on the computer. I'm sure many of you guys have neck or back pain or even experienced it once in your lifetime. Can I have a show of hands? Is it possible to do this in the Zoom or a pool? Let's see. Of who of you guys had any experience of back or neck pain? Or just comment in the chat box. I want to know. Neck tire. Okay, that's obviously very common. All right, work for 1 or 2 hours, should have this neck tiring or even shoulder aches. All these are very, very common among young people and even like working adults who works for, you know, most of the time I receive patient who works for more than 5 years, they start to have all these chronic injuries like their neck, their upper back, and even their hand starts to get numb. All right, all these are chronic issues already. Yeah, this is not normal at all. Right, one shouldn't feel any neck or back pain during working. Right, yeah, finger numbness. Can you believe it or not? Because the neck is where our brain, supplies the nerve to the hand. It crosses the neck, even crosses our chest, and only it goes down to your hand. So if you have neck issues, underlying neck issues for a long time, that nagging pain, if you accumulate for a long time, it will start to become chronic in the long term, right? And that's where hand numbness can be possible, right? Okay. So again, I want to point out, oftentimes people ignore all these symptoms and proceed their work like like normal because they think it's normal to have neck pain or back pain when they're working just because they are tired, that's all. And when they sleep and the next day comes back, then they continue this cycle over and over again. But that is not normal at all, when it starts to have all these symptoms. All right. Let me explain further later. Okay. Okay, let's have a look at how chronic disease progresses. All right. Of course, this is just one of the many, many examples, and this is very common. It's called the sciatica. I think many of you have heard this before, all right, where we have a lower back pain, and the pain actually radiates. It goes down to the back of our buttock, all the way down to the hamstring and the calf. All right. We see this a lot, not in old people, not in auntie only. Nowadays, young people, everyone is having this because of the prolonged sitting issue, right? Which most of us have. Okay, so it starts with, let's say, a normal disc. We look at the left figure, right? Spinal conditions. All right. On top to bottom, there is different conditions. Firstly, we have a normal disc. Secondly, degenerative disc. Degenerative disc, as you can see, the disc is slowly thinning, all right? And also some damage going on. It's like a small tear there, right? This degenerative disease is caused by if we are not active, we do not use our spine a lot. Like let's say, for example, we are sedentary, we don't move much, we sit a lot, right? So your body starts to detect, like say, hey, my host is not even using this part of the body. So why should I continue to maintain this state? So the disc starts to degenerate. It doesn't need to use. It feels like, oh, my host don't need to use this part. Okay, so I don't need to provide nutrient to this area of the body. So degeneration happens. All right. Okay. Moving on. The third one, we can see a bulging disc. And bulging disc is a starting symptoms of the herniated disc below. Now, herniated disc is very severe because, as you can see in the middle picture, right, when a herniated disc or a bulging disc gets more severe, it actually hits the nerve. The yellow color one is the nerve. So our nerve from the spinal cord, from our brain, it will go down and then to the lower back, or even from the neck, it branches to left and right side. That's how it supplies to your left and right limbs. And when you can see in the middle picture here, the herniated disc is hitting one side of the nerve. And this nerve is the exit of the spinal cord, which it will supply to your muscles in your lower limb, as you can see on the right side. All right, sciatica. You can see the pink color section and also the blue color line. The blue color one is your nerve. That's your sciatic nerve, one of the major nerve in our body and the largest nerve in your lower limb. All right. If the disc in the center is already hitting the nerve, it will affect all throughout your right side, as in this picture lah, we can see. All right. Some people feel weakness, pain, or even numbness. And the worst case is if the nerve is damaged to a certain degree, they might even feel burning sensation, or even like something like they will complain like, oh, if they feel like ice cold, because the nerve is responsible for receiving signal to our brain, right? So when it is compressed and a prolonged period of time, it will get like haywire, right? So that is the worst case scenario. And most of the time, surgeon or doctor will suggest to operate to remove that section of the bulging disc or the herniated disc to solve this issue. Now, before we move on to that worst case scenario where the surgeon will suggest that, why not start early when the symptoms is already there? You do physiotherapy intervention. This is, of course, the most ideal, and doctor will also suggest so, right? Before going for surgery, go for physio, because we can detect all this bulging disc or even the degenerative disc. We can detect the symptoms, and we will ask to do some movement and all that to check. And later I will explain further with this. But I'm just saying that physio can help to give the early intervention to prevent that radiating pain that we can see on the right side, the sciatica, right? So this is how usually chronic disease progress, all right? We can reverse that, okay? And we will go through that, all right? Okay, this one is very interesting. It's called the muscle trigger points. Some people may know, some people may not know, but these muscle trigger points actually affects a lot of things, right? Let's just go through one of the trigger points that is very common, okay? Our upper traps, which is this part of the muscle, all right? We always feel tension here, all right? When we work and study or whatever, right? We always feel the tension here. It is the most common tension point here. All right, now how trigger point is formed is from weakness of the muscle, right? When the muscle is weak and we still demand the body to use that part of the muscle, trigger point will start forming. And also the muscle tension will get higher because your body is trying to maintain you in that certain posture. Let's say we are fixating our eyes to the computer. Our neck has to stay upright. But because of weakness, okay, um, your body still needs to maintain you in that posture, right? So it will send signals to your muscle, ask it to tense up because it needs to continue at that posture, right? And that for the long term, it will form trigger points, okay? One of the many reasons, muscle weakness, okay? And in the middle section, we can see trigger point referral pattern. Okay, referral patterns means that the pain actually, let's say, the trigger points, the X marks are the trigger points in the figure. And the pain is not just localized at that section, but actually it radiates. It refers to other areas, like, let's say, for example, in this picture, it goes to the eyes, around the temporal here, and even goes to your forehead, or even the ear. You can see the red marks there. So this is very interesting because when we treat headaches, we will tackle this muscle, and actually patient feels the referral pattern. Even when we are working on the neck, they feel it in their eyes or even their ears. Yeah. So this is the power of trigger point and how damaging it is, right? So how do we solve this in a physiotherapy setting? Of course, we have manual therapy that we'll do. And secondly, the most direct one is trigger point dry needling. This will directly put the needle into the trigger points, release it, and then we'll take it out the needle. Yeah. Okay. Now I'm just gonna talk about how we detect and prevent further damage to that chronic state. All right. We want to do early intervention because early intervention is key to prevent chronic disease. Right. So how do we do that? First, we screen for the posture. Okay, we check for asymmetry, any muscle imbalances going on. We will ask patient to move their left arm or right arm just to check the imbalances and check the movement quality of it. And of course, we also do manual assessment, which is our hands-on. We will test the joint for to see any ligament issues and whatnot. Of course, we have more than these screening techniques, all right? But we are trying to identify which area is the weakness, which area is too much tension on that, and also the movement quality and to see the muscle imbalance, right? And then, of course, we do treatment, right? Our treatment mainly is to prevent chronic pain, right? And also to treat nerve impingement, degeneration, and many more. And lastly, we will have follow-up, all right? Say, for example, after 1 month, we want to check for the progression, any progression of the disease, or is it getting better? All right. If it's better, good. Then we will give more exercise or even the uh, better exercise to target the weak muscles. Right. So that's how physio works. Right. Just a few examples here. Posture assessment, we do movement assessment, we do hands-on assessment. And I just want to share with you guys one of the case that I treat last week. All right. So this client X, has a goal to perform deadlift with a proper form. Okay. So the first thing that we went through is okay, since you want to do a deadlift, which is shown on the top middle picture there. All right. As you can see, the spine and the head and even the hips is in a straight line. Okay, that's the ideal posture or ideal form when you do a deadlift. As you can see on the left picture in the figure one, you can see how much of a deviation of her neck and even the hips is going in accordance to her spine. It's just not a proper form. All right. So what we did is we do physio treatment. All right. We tackle the tightness issues in her hamstring and her hips. Okay. After that, we do reassessment of the movement, and then we provide proper cues and education, as you can see on the figure two. All right. We teach her the proper movement, and eventually she achieves that movement. All right, but she haven't tested her deadlift, so therefore follow up is important because I want her to test doing that lift, the deadlift, and see how she goes. Will she still have issues in her hip or hamstring, or will she be good? All right. So the second question for you all, okay, just ponder it lah. What if client X proceeded to perform deadlift in the form of pre-physio intervention, as you can see in figure one? Definitely, we kind of, expect that she might hurt her back even furthermore, or even the neck might hurt more, right? If she sticks to this form as in figure one. Okay. Okay, I think it is more or less, it's not 30 minutes, yes. Not 30 minutes yet, but it's about 20 plus minutes. But let's assume it's 30 minutes. All right. I want every one of you to, if you can, stand up from sitting down. Okay, give yourself a break. All right. If you can, you open your cameras. I want to see. Okay, because I want to initiate some daily movement rituals for you. okay, for you to prevent chronic disease that are most common, like just now I've shared about sciatica and also the neck trigger point, right? Okay. So this standing up is very simple to do, all right? And everyone can do it like within, an interval of 30 minutes between your work and, then you can stand up just for 1 minute or even 30 seconds is already good enough to reduce the stress on the spine. Okay. Now, okay, since everybody is standard or standing up already, okay, we can do an exercise. Okay, exercise B. Okay, we see chin tuck, right? All right. So we want to do chin tucks. Very easy. How do we do chin tuck properly in a proper form? Okay, basically you want to form a double chin, right? As shown, right? You form a double chin, and if you have access to a wall, it's even better. From the side view, you can see if this is my relaxed posture, I can chin tuck and see a straight spine from the side. If I have a wall to assist me, it's even better. I just lean towards the wall and I do chin tuck. Just ensure that your chin is trying to touch the neck, and there will be a little bit of double chin forming, which is normal. Okay. So what this does is that it helps to reduce forward head issues, and reduces the strain on the upper traps. That is very common that we see. Okay. Forward head meaning that the head is more protruded forward. Okay. And also with that, if there is progression, you can even see rounded shoulders and forward head. This is very, very common among people who works in the computer a lot. I see most of them are from accounting, from banking, and whatnot, right? Okay, now again, we want to move on to the next exercise, which is the hip flexor stretch. C, yeah, C. Okay, I will demonstrate, but I don't know whether this webcam can see or not. Let's try. Very simple. Anyone can do it. You just need a chair. Okay, with a chair will be easier than on the ground, but this is just a modified version. Okay, so
Jonathan, if you are showing a demonstration, maybe you unshare the slide, then we can see you. Is it better that way?
oh, you can't see me now, is it?
I can see, but then if you are to show the movement, maybe we cannot see so clearly. I'm not
Ah,
sure about the rest.
okay. So I just stopped sharing.
Uh,
Can you see me better now? Or how should I do it?
if everyone change the view to speaker, then we will see you
Mm,
big enough. Yeah,
okay.
yeah. Can everyone
So
see the speaker view? I suppose can. Lah. So you try lah.
yeah,
You
can.
show us. Yeah.
All right. Very simple exercise. This is for our hips. Let's see. Yeah. Let me adjust. Okay. Basically for our hip flexor. Okay. When we are seated, this muscle right here, I see a bit of blurriness there. This muscle right here is tight all the time when we are seated. All right. So in order to fix that, we want to stretch it open. So we just want to open up this muscle. Can visualize, right? So again, hip flexor as shown as in my fingers, when it is shortening, it's like this, which is the posture when we are seated all the time, right? In order to reverse that, we want to bring it backwards to stretch, open this muscle right here. And how do we do that? Right, I try my best. Huh? Okay, so just remain seated. I turn off the blur first. Okay, so we are seated on the outside of the chair. Okay, just half of your legs is on the chair. Okay, we want to bring this leg backwards as shown. Okay, and that will already stretch your hip flexor. You should feel it in front, near to the groin, but in front, and it actually stretches all the way down to the front of the knee. This whole part, you will feel the stretch as you do this. Okay, just like that. Okay, hold it for 30 seconds. Just breathe normally. Okay, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 3, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, just as simple as that. Can even do the other side just for the sake of balance, right? I'll just do it on the other side. So just open up, feel the stretch all the way down to the knee, all right, from the front hip. You want to hold that. 6, 7, 8, 9, 10. 2, 2, 3, 4, 5, 6, 7, 8, 9, 10. 3, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. Don't you feel better already? Okay. We still have, do we still have any exercise? One more, right? Okay. Let me share screen first. The A, okay? A is the thoracic extension. Okay, I just want to say, like just now, the C that we did, the hip flexor stretch, is to reduce hip tightness, right? Again, when we are seated, the muscle is contracted all the time, right? So we just reverse the action to stretch the front hip. So that's how we prevent hip tightness. And then with that hip flexibility, it will help your lower back because both of them work together, the hip and the lower back. All right, now let's tackle the upper back. Just now I asked the question, right? Like who here has neck issue or just now Lee said about shoulder ache and Prem said yes, your back. Uh, and then the host is it waist also feel tired, fingers or numbness and all that. Right. So this exercise is very good. This is for your upper back. It opens up our spine and it actually it's a reverse slouch movement, right? Who doesn't have slouching issues nowadays, right? Because of the computer. Same with the chin tuck and all that. It comes together. Okay. As we have forward head, we slouch our shoulders. This is the progression, all right? So we want to reverse it way before any issues come. Okay, so again, I'm gonna demonstrate this exercise. Very simple. Okay, all right. I've stopped sharing. Okay, so you just want to place both your hand, fingers crossed together, bind it together, put it behind your neck, if okay. If you have shoulder issues, you might not reach your neck, but you just put behind your head is also fine. All right. And you try to extend your back, face back. You feel a slight pressure in your upper back. Some with chest tightness, they even feel the chest starting to stretch. You can open up your hands bigger, wider, so you also get that stretch in your chest muscle. Hold it for 10 seconds. Try to breathe normally. and then come back. Okay, we do 3 sets, huh? Okay, again. 2, open up as much as you can, but you don't force yourself. All right, try to breathe. 3, 4, 5, 6, 7, 8, 9, 10. Okay, relax. Okay, you can, when you come back, you can close like this, no problem. Okay, and then when you open up and go to the back, you can open up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and come back. All right. So that's the reverse slouching movement that I always teach my patient. But this right now that we are going through is very convenient because I am purposefully made this just so that we can do exercises when we are seated or even when we are doing our work. So it shouldn't mess up with our schedule or, you know, a lot of my patients say, oh, I got no time to exercise. So most of the time, we can always modify our exercises to accommodate, to each and different lifestyles, right? It's very important that we move. So can you imagine if everyone, who are chronic users of computer or chronic sitting, if they do this exercise daily, how much of chronic disease they can prevent, all right? If you start early, okay? And you can do that too, all right? So these are very simple yet very powerful exercises. Okay, now next one. Okay, micro habits and ergonomics. Okay, so what are micro habits and ergonomic that we can do? All right. So first thing first is very simple. I like to do the 30-minute rule. All right. As just now I shared in my slide, right? I say 30 minutes up. So we need to stand up. All right. This tremendously they will help to reduce the pressure on the spine a lot just by standing up. Because when we are seated, believe it or not, our pressure on the spine is more than when we are standing in the long term. All right. Therefore, if you you try lah, you see, you try if you are seated for a long time. Let's say try to stand after 30 minutes of work, just 1 second, and then you sit back down. You feel much better, right? As simple as that. You're just trying to provide more blood circulation to the body, from your lower limb back to your heart and keep it going. All right. If you imagine if you sit for a long time, not much activity going on, your blood circulation is getting slower, and therefore your lower limb is just not getting the nutrients. All right. The muscles and all will get fatigued very easily, and therefore back pain happens. Right. Okay. Next, talk about ergonomics. This is also equally very, very important because most of our time, if we are working, let's say I talk about an accountant now, all right, about 6 to 7 hours of work every day, seated in front of a computer, all right, or a banker, let's say, all right. If their ergonomics is very poor, they don't maintain, all right, the right height, eye level of the screen, the keyboard placement, and also the seat, the office chair that they are sitting. If it's not, you know, tweaked well, it will cause a lot of issues further down the road as they work, you know, for longer. The longer they work, the more issues may arise. So we want to prevent that by adjusting the ergonomics. In this picture, it's just a very simple guide to tweak, to change if you can. Right? There are always many ways to adjust all this, right? You just need to be creative with that. Yeah. Okay. And last but not least, reminders. Very simple too, but yet also very effective. All right. You set reminders every day to just move a little bit. or even like let's say you work from 9 to 6, in the middle, let's say 4 p.m. or even 11 a.m. You set reminder for yourself to do a little bit of exercise, raising your arm. I don't know, chin tuck, like just now what we go through just now. Just do a little bit of those in between your work. It is very possible, right? And that's how you do micro habits, all right, to change how your body feels in the next 5 to 10 years. Okay. All right. So um that's all for my talk. Okay. It's been 40 minutes. All right. Thank you so much for your time, and I hope that I give you a positive impact in terms of your physical health. All right. This QR code is our Instagram page, Ease Physio and Rehab. If you're interested, can give us a follow. We do produce a lot of content in there, very useful content. All right, I show various exercises for various conditions. So you might have those conditions, right? If you are not free for physio, maybe you try those exercise first. I give a very complete exercise in Instagram. Right, we demonstrate the exercise. We give you how many reps, how many sets to do. You try those. It might be effective for you. All right, and you can check out our website. It's in the bio, in our Instagram. All right, yeah. So
All right. Thank you so much, Jonathan, for the insightful sharing. I think I also learned a lot. I'm wondering if any one of you have any question, you can type your question, or you just on your phone and sorry, your speaker and speak. I saw a message from Chin YM. Can cross your leg while sitting long hour in front of desk. I think it's a question. Can we cross our leg?
okay, so yes, I was just replying to Chin YM. All right. So it's not really a good idea to cross our leg. Okay, if we do a traditional crossing lah, okay, cross leg, like you know how the media portrays women, right? They will cross leg like this, all right, just like that. The normal one lah, all right, where we close our legs like this. But instead of crossing your legs, right, why not you do a stretch? It's called a piriformis stretch, huh? So instead of in this position, like showing now in my webcam, all right, you open like a figure of four like this. You can see, all right, and then everyone can try, you do a figure of four like this. You just put your uh one of your legs on top of another thigh here, and then you just lean forward, just like that. You will start feeling your buttock stretch on the side of your leg crossing. All right, that is actually your piriformis muscle. You're you are crossing your leg, which is maybe your habit, right? But at the same time, you are incorporating an exercise, which is good. So instead of the traditional crossing the leg, you do a piriformis stretch instead. Okay, you can search in Google. All right, you search Google image, sure will pop up on piriformis stretch. The first one will be just crossing your legs, which is the figure of four, and then you just lean forward. You get a good stretch.
Okay, thank you for the tips. And another question, what kind of physio need to be done after marathon?
Marathoner.
I think it's
Um, can in terms of your muscle soreness or your joint pain after marathon, we can help. You know, and especially like uh some people might have ankle sprain, or even the joint they get inflammation. Maybe they are just not used to running, and they start running marathon just for their bucket list, let's say, right? Those acute conditions, the acute swelling, right, we can treat early to prevent further damage, and that's why it's important to start as soon as you have symptoms like this. Yeah. to prevent chronic diseases. Yeah. And also I get a question from Prem, right? Like physio can help with regeneration or degeneration issues, yeah. Of course, yeah. Yeah. Of course, like we get elderlies that already has degeneration issues, all right? But we want to prevent further degeneration, you see or not? You can't just ignore the current degeneration and say, oh, it's too late for me to do any physio already lah because I already have degeneration this. But that is the wrong concept, right? We want to strengthen those weak muscles to prevent further degeneration. So that's how physio can help. Okay. Let's see. From Chun. Uh,
He's saying, put wallet at the back also can
ah,
get spine issue.
oh yes, because a lot of guys especially like they like to put their wallet at the back pocket. And
Yeah,
when you sit on top of that wallet, of course you get a slight
not
asymmetry.
balance.
Yeah, your hip will hike, your lower back one-sided will get very tight over the time. And also that is the specific spot, the piriformis spot, like just now we stretched that muscle. It is compressing against the piriformis. That's why it's causing sciatica symptoms and all that. If you do, you sit on the wallet. Yeah. So you do more piriformis stretch and then prevent putting wallet in your back pocket. That's very bad. Mm.
Okay. Okay, Tiong Hui asked, massage help or not?
Massage.
Uh,
Depends because massage there's so many types, right? Like we are familiar with what Theta, or we're familiar with Thai massage, or even Balinese massage, all sort of massage lah. All right. But the problem is it's more for relaxation, right? Some claim to treat, yes. But why is it different when we talk about physiotherapy, manual therapy intervention in physiotherapy, right? What is the difference between massage? So the main difference is we do a full health screening before we do any intervention. So that's the thing. We identify which muscle is tight, which muscle is weak, which muscle is causing the current symptoms that you are facing. So we don't simply treat or massage the whole body. That's not what we do. We do only on the muscles that are related to the symptoms you are having or any problems you might be facing. And so I would, of course, I would say physio is the one to help. Yeah.
wow.
Okay.
Okay, we'll take in one last question and then
Last,
we'll pass then we'll
okay.
pass the time to Dr. Ngo.
Yeah. Last one from Katerina.
Yeah.
Okay. Is it okay to crack my back on your own? Okay. So cracking a back. Okay. If we talk about cracking, oh, we think about the Instagram, we see a lot of cracking videos, right? Like they crack the neck, like very satisfying and all that. But actually, in the long term, it's not recommended because if you crack your back, you are putting your body in a range where it's beyond its normal range. That's how they achieve a crack. You know what I mean? So let's say, for example, my shoulder only can go to up to this range, but in order to crack my upper back or shoulder, it will go a further rotation in order to achieve a crack, right? And in that position, you actually stretches your ligaments, which is the one that is holding your joint. Ligaments are responsible to stabilize our joint. If you do crack, it will stretch the ligament. And in the long term, if you do that, your ligament will start to become lax. Laxity means it's become loosened. All right. In the long term, with that, right, you might feel temporary relief every time you crack. Okay. But in the long term, your body will sense the laxity of the ligament and it will start to signal your muscles to be more tense in order to achieve stability. So is it good or not in the long term? I don't think so. All right.
Okay, thank you. Thank you so much, Jonathan. If If there are more questions, you all can continue typing in the chat box or yeah, and then if in the event Jonathan still there after at about 10, we will invite him to answer again. Yeah. All right. So now I would like to invite Dr. Ngo. I would like to pass the session to Dr. Ngo now. Are you there, Dr. Ngo?
Hi.
Hello.
Hi.
Good. Okay, Ken. I need Jonathan to remove the screen sharing for now. I'm just thinking maybe we can take a group photo also before
Yeah.
Dr. Ngo start talking. Okay, if you all don't mind, can you all on your camera? I will just count 1, 2, 3. You're on for 3 seconds. All right. 1, 2, 3. Okay, I have just captured. Wait. I captured again because I just saw Catherine on the camera. Catherine can on again. Okay, 1, 2, 3. Okay, good. Okay, so Dr. Ngo, I pass the session over to you now.
Hi. So sorry, just now, I just spoke to Jane. Then I wanted to come in already. Then after that, suddenly there's a accident. So wait, I actually looking for the share. Okay, is it this one? Wait, can you guys see my slide? Something wrong with my this thing.
Oh, I cannot see your screen. No.
Cannot.
Oh,
Somehow I cannot share my thingy. Wait,
you would you like to send the PowerPoint to me? Then I open up from my side.
uh, hold on. I see what's happening. Program access. I think this one.
Okay, I forgot to introduce Dr. Ngo. Dr. Ngo is our Qua Foundation scholar. He is a consultant bariatric surgeon working for a hospital in Kluang. Yeah, so now he managed to share his slide. I will pass the session over to him.
Okay. All right. Sorry for the small hiccup. Today there's a lot of hiccup. So okay, look, I had to congratulate Jonathan for the very insightful talk before this. I always like my physiotherapists also. Because actually I'm a um currently we are trying to rebrand bariatric surgeon, you see. So I would like to call myself as the upper GI surgeon because there are some issues lah. So and this is actually my LinkedIn. If you guys who don't know me, who wants to know me, then you can actually QR code this thing. So but today I'm going to be very very short and sweet lah. Last time I was talking about bariatric, right? But Jen actually told me to talk about how to live healthier. It's like okay, I try my best, right? I'm going to talk about what your grandpa and grandma told you lah. All right, it's the same thing lah, the same neck lah. All right, actually you can stop me. All right, I'm going to give a few insights. And this is my hospital. My hospital is not so big. It's only like maybe 250 beds. But because my passion is more in bariatric. Actually, I won't say bariatric. It's a metabolic bariatric surgery. Nowadays we are running away for bariatric. We want to say it's an MBS because a lot of people they they uh um they sort of find it weird. Why is there a bariatric surgery in the government setting? Right, because we are actually not looking at bariatric, we are looking at metabolic part of it. Because once we know that the weight is actually associated with your hypertension, associated with the diabetes, associated with hypercholesterolemia. So once you can reduce the weight in the sense that it's a fat mass, you actually can reduce your diabetes, hypertension, and hypercholesterolemia. So that is actually metabolic syndrome. Disclaimer, I'm actually, my main hospital is, even though in Kluang, but I'm actually covering Johor, North Johor. So Batu Pahat, Segamat, Muai, Melaka. And also monthly, I do visits to Terengganu, the East Coast. That one will include Kelantan, Terengganu lah, right? So okay, this is what I'm talking about. Bariatric, metabolic bariatric surgery is nothing but it's just morbid obesity and also metabolic syndrome. Let me talk a little bit about weight, because tonight I'm not going to tell you, like last time I told you guys a lot of principle of bariatric surgery, right? But tonight very short and sweet. Let's talk about weight. So the weight is very important, right? So actually there's a lot of kind of weight. And one more thing is about body mass index. Body mass index, I think everyone here already know already. It's kilogram height over height. So why is it BMI is very important? Because if the BMI is high, you become obese. And in Malaysia, international index, we will say obese type 1 is 30. But in Malaysia, because we are Asian country, it should be 27.5 and above. Okay, so if 37.5 and above, actually it includes most of us, All right. So why is it important? Because if this one is 27.5, you will tend to have diabetes, you will tend to have hypertension and all those kind of metabolic problem. There's also mechanical problem in which and we'll go and find Jonathan already, spine problem, low back pain, right? There's also because of obesity, and knee pain, osteoarthritis, then even the obstructive sleep apnea. All this is caused by obesity itself. This is I always like to show this slide, right? And this slide actually shows you that our obesity in Malaysia is actually increasing. So I guess I really told everybody already, this is not like unpublished data, they are publishing it. 2024 is already like, they quote 68%, but actually it's around 70. But the thing is, a BMI, this is all BMI more than 25. It's not there is a 2.5 there, but whatever said and done, why we've put a 25? Because 25 internationally is already the overweight, right? So they include overweight and obesity, right? But the one problem with BMI, this is a study that came out early this year. Then is in March. So it's still very warm. This is just come out from the oven. So this is by IFSO. IFSO is the International Federation for Surgery of Obesity. And this is the current obesity, the definition. They would like to classify clinical obesity. So what is this clinical obesity all about? Because we understood that BMI is not useful. It's useful for certain thing, but it's not useful if you trying to get healthier. That means you get the lower BMI, because it is not a direct measure of fat, and it does not establish the distribution of the fat around the body. And it also cannot determine when the excess of body fat is a health problem. So what I always tell everybody, right? Look at The Rock, right? The Rock, Dwayne Johnson, right? His BMI is 34, but the body fat is 10%. You will not say Dwayne Johnson, The Rock, is actually obese, right? He is healthy. He is healthy, all right? Because all the weight is actually the muscle mass. It's not the fat mass. So if you look at this, if this patient overweight, 28.2, or this is me lah. Okay, this is 28.2, and then the excess body weight fat. Oh yes, your excess body weight. Sign and symptom of obesity, no. So they will actually underdiagnose the obesity. But actually, this patient have excess body fat. So you will underdiagnose if you just look at BMI. And you look at this 30, BMI or 30, then has excess body fat, there is a symptom, and this is already included to become the obesity. Then this is overdiagnosis of obesity already. Because this individual, probably he has a high muscle mass, right? Tend to have a high BMI because the muscle is actually higher, right? And diagnosing such people or having obesity is actually inappropriate because they will thought that they are actually obese. In fact, they are not clinically obese. Okay, let's look at this 36.2. BMI 36.2, yes, excess body weight, excess fat, but this patient have no symptoms, right? And this is obesity with preserved health. That means the patient doesn't have any symptoms. Symptoms or complication, those are like diabetes, hypertension, OSA. Those are the complication that I spoke about just now, right? Let's say this patient doesn't have it, but this patient, we call it a morbid obesity already because he has excess fat. Then 36.2 also. Let's say this is 36.2 as well. And this patient have obesity with ongoing illness, right? And both of these patients is actually clinical obesity. All right. Sorry. Okay. So okay, I always show this is actually I recently I actually started to play this ChatGPT. So I asked the ChatGPT to draw this thing for me. And this is like this is very quite cute, but whatever it is, this is the one of the body composition component, right? If you look at the scale that you measure, right, this actually is everything. So the overall weight, you have fat mass, you have muscle mass, you have bone mass, and you have total body water as well, right? So that's why overall weight, what I'm trying to say now is, please do not look at overall weight only. So you must understand that what we want is actually increase your muscle mass, and we want to reduce your fat mass. Like actually, bone mass is that the change is negligible on a yearly basis, right? So that's why body water it will be around the same. So that's why it's always muscle mass and fat mass. Oh, for those, if you guys are using those medication, right, it's good. But the problem is if you eat wrong, if you eat wrongly, you eat a lot of carbs and you don't eat a lot of protein, then definitely you're going to sacrifice your muscle mass and you are going to increase your fat mass, and this is not good for you, right? So as I always say, it's a BIA. BIA is a body impedance analysis. You must have this machine, right, in order to know that if you're healthy or not healthy. So like what IFSO is doing now, they are advocating to measure your excess body fat rather than your overall weight, right? Because if this, you will come out with like this, right? The results. You have water mass, you have the protein mass, you have the bone mass, you have the fat mass, right? And they actually, a good machine will tell you the distribution of your muscle mass. And like this patient is actually very good. This patient is the whole upper limb and lower limb is actually is a normally distributed, right? So total body water usually is 30% to 45 lah. So that means this adequately hydrated. And if you look at this, the best thing is that they can have these parameters, right? This is the overall weight. And you just look at, even though it reduces, okay, this is 1 month. I think this is 1 month apart. Yeah, this is 1 month apart. So you look at this initially when he come to see me, right? Then after that, I never operate on him. Then he just do some nutrition intervention and also some exercises. So you see the weight actually reduced, and the reduction of weight is because of the fat mass. It's not because of the muscle mass. So this is good. But the problem here is, if you look at this, the muscle mass drop. And this one is, even though it's like it dropped a little bit, right? Like, wow, if you don't have the composition, right, you would think over here he's good. Actually, it's not good. Because even though he dropped, but the thing is the one day he dropped is actually a muscle mass. And actually the fat mass increased. So from here to here, he is not healthier. He is actually less healthy. Then when he saw me here, he got a nice screwing for me lah. All right, because he already not going to exercise and then started to eat the snacks and everything, right? Okay, so even though you see this one, the fat, the overall weight is increased, 72.9, but like 200 gram, right? But the muscle mass is the one that increased. But if you look at the fat mass, it's actually reduced. So actually from here to here, he's healthier, even though the weight is increasing. But that's why I always like to show this trend, this patient's BIA, because it's quite interesting. Everything is inside. So that's why I hope you already try to see that is why I always say don't look at the overall weight. Okay. So that is about weight. So once we already have the consensus, right? Right. So we must understand this, the sleep. All right. The sleep itself is actually is vital for weight loss. Okay. Why is it so? Because actually we are looking at hormones, you see. So when you sleep, we don't really know why people wants to sleep, right? But the thing is, if you sleep, there is a hormone is called a leptin. Leptin hormone is like my favorite GLP-1, right? The GLP-1 is also a satiety hormone. Satiety means there's a lot of Chinese here, right? So the 饱足感, when you eat, you have the 饱足感, right? You don't have, yeah, and another one is 饥饿感, right? Right. So you have the satiety hormone. So when you are satiety, when you're satisfied, right? So how to say? You won't eat so much lah. All right. So but leptin will reduce if you have lack of sleep. So if what WHO told for ages, right? We know you must sleep at least 7 to 8 hours, right? We must have a good sleep hygiene. So how do you have a good sleep hygiene? Is that you must have a also when you sleep, you please reduce this blue screen, all right, at least half an hour to 1 hour before your sleep. But for us, actually, we very difficult to do, right? Some of us also, when we sleep, we are looking at the phone as well, right? So that is actually not good, right? And sleep also will increase actually the metabolism. Sleep will actually reduces the metabolism. Once the metabolism is increased, then you will actually the body will try to conserve energy. The body will try to conserve energy, all right? So it will actually store as fat. So that is the problem with sleep deprivation. And also sleep deprivation actually reduces the insulin sensitivity as well. One more thing is good sleep actually preserve lean muscle mass. This one, a few studies have already shown already, like they ask the subject to go sleep a few hours. This one, how many hours? And then we noted that if 6 to 8 hours, is actually you will preserve the lean muscle mass, right? And of course, the energy and activity. If you don't have sleep, you feel fatigue. If you feel fatigue, and then in the afternoon, in the daytime, and then you take a nap, or maybe you just don't do anything, right? So that was also in preserve the energy, and then that will also preserve energy as fat. So that's why sleep is, even though we don't really know what's happening, why we need to sleep, but we know if you don't sleep, those are the effect. That's why you must sleep lah. So if you really want to be like Aaron Aziz or who what Tom Cruise so you must sleep more lah. Okay, right. So this is the sleep hygiene. So you have a regular schedule every night around what time, then you should already sleep. limit your screen time. It means your handphone, laptops, right? And you must create a sleep-friendly environment. So, of course, that is why we need a bed, right? Like in mattress also, you need a better mattress lah. That is a good investment. And you avoid stimulants. Those are coffee, tea, right? Of course, alcohol. And try to wind down at night. Don't do heavy stuff lah, right? And get some daylight exposure as well. Like this one actually is a good advice as well. Of course, be physically active lah. Once you exercise more, actually you sleep more, right? Though that's about sleep. What I like talking like 10 minutes for sleep. So hydration as well. Hydration and weight loss. The appetite control is better if you have more hydration. So a 60 kg human being, you should have at least 2.5 liters of water. 2.5 liters of water is like your two big bottles right? You must have at least that. Or people will say 7 to 8 glasses of water, right? That is actually translate to 2.5 liters of water, right? So why we need to have a good hydration, because you need water for you to have a metabolic boost. That is the thermogenesis, right? If you don't have no water, usually the metabolism will come down. So that is the problem. And the fat metabolism as well. If you really want to break down the fat to become an energy, so you must have water as well. So that's why is actually very, very, very important if you really want to lose weight, right? Or stay healthy. Number 2 is hydration, right? This is like what your mama say, right? So yeah, sarcopenia, I think I already discussed in this group already. What is sarcopenia? Sarcopenia is actually the loss of muscle mass or loss of protein. So the cause of sarcopenia is because it can be physical inactivity. It can be because of obesity, right? There is such thing called sarcopenic obesity. That is a big problem. Another big problem of sarcopenic obesity is there's no definition yet. We know it exists, but there's no definition because all the experts they couldn't agree with each other. So never mind lah, a few more years maybe we will see the definition of sarcopenic obesity. But one thing is, you look at the patient is like obese, but the problem, the patient is obese, is not healthy, is because the muscle mass is not enough. So and then other things is like this chronic diseases. Chronic diseases will have some like it's a protein losing condition, you see. So like kidney disease and all this will cause sarcopenia as well. If you are not mobile, right? So you will become sarcopenic, right? Because the muscle become we call disuse dystrophy. That means the muscle is not being using. We don't use so much. The muscle will just lose its mass. Uh, the the worst part is if you don't have more protein, you will have insulin resistance. Right? You are insulin resistant. If you have insulin resistant, that is actually a type 2 diabetes mellitus. Right? So to slow down the progression, you have to eat healthy, you have to exercise, you must have a routine physical activity. All right. So my favorite topic is protein. Those who comes to my bariatric program in the Guang, they will know that I don't focus so much on calorie, right? Because if I going to do the type of MBS that I'm going to need, you have less craving for sugar, right? But the problem is protein. Protein is you must consciously and subconsciously go and take more protein. But the problem is protein is not all protein are the same. Protein has their quality. The quality of protein means how much of the protein it will get absorbed into the body once it's been taken, right? There is a score, it's called PDCAAS score, right? And this score, if must be 100% is 1. If you look at milk, they will have a solid and water. Okay, so 87% of the milk will be is actually have some protein inside, and the protein is only like probably 30%, 27 to 30%. Then most of them are fat. And not to say these fat are not good. This fat is actually quite good. Fat is actually better than sugar. Sugar is actually the worst, right? So if you have protein, a natural protein, this is like at this layer, those are the natural protein, like you eat chicken or you drink your milk, right? And this layer, you always come with lactose. I mean, if let's say it's a meat, they won't have lactose lah. It probably you have just a fat and protein. It will come in package. It won't. That's why the protein absorption is not so good. So you can actually synthesize it. You synthesize it and then you become whey protein or casein. Right? If you have casein, right, this is in the milk. That's why casein is 80%. If let's say in the meat, they won't have so much. Right? A casein is good because once you take the casein, then the casein will be absorbed straight. Right? Casein is one of the best. But whey protein, there are 3 types of whey protein. Whey protein, you always heard of this, right? All the muscle builder will take whey protein. But if you are very rich, all right, you're filthy rich, you are wealthy, and you actually there is product, casein product for you to take, right? But it's okay. Then we'll have a whey concentrate, you have isolate, you have hydroxylate, right? So hydroxylate will get absorbed more. So if that's why if you look at this is actually at the protein powder already, right? But the problem with whey protein, it doesn't smell good. It smells more like a cat's urine. So that's why when you have a product, let's say whatever product, you have a whey protein, right? Then you want to drink the protein powder, right? You always lace with sweetener. So once you have a sweetener, it is calories, right? That's why if you really want to take a whey protein, you must build your muscle. You must shed off the calories. So only then you can get absorbed. And one more thing, if they say this is a whey protein, if you don't work out after 1 hour or 1 hour apart lah, if you don't take the whey protein 1 hour apart after you work out or before you work out, the protein is not going to get absorbed because all these have been digested until very, very small already. So if you do work out, you just take whey protein. Then one thing is you take the more calorie, and number two, the protein never go in. So that's why whey protein is better for you if you are those who go for gym lah. If you don't go to gym, actually there are other things. It's like soy protein. Soy protein will be better, will be milder, right? Even though the quality is not as good, but the thing is you don't take in the calories lah, right? So this is all about the striking the balance, the calorie deficit. Calorie deficit is like this: the energy that you take, right, and the energy that you spend, right? If you spend more energy, it's like your pocket lah. That I think there are some accountants here, right? Okay, so it's very easy. The debit and credit, right? If your credit is more than your debit, right, that means you will lose a calorie. I do not agree with those they said low calorie diet, very low calorie diet. Right, very low calorie diet is less than 500 kilocal per day. 500 kilocal, let me put things in perspective. 500 kilocal is like your half of your nasi lemak only. So you expect to take half of your nasi lemak the whole day. that is very strict. And low calorie diet is like maybe it's around 30 to 40% of the total requirement. It will come to be like 800 to 1,002. Even with that very like low calorie diet also, I don't really advise that, because you know why? This is dynamic. Let's say you need to know how to calculate the calorie. It's just agak-agak only. All right, just agak-agak, or sometimes when you have from the package, even though I don't really advise lah, I don't really encourage that you take from the packet food, right? And the packet food, then you can see the nutritional sheet, right? The nutritional sheet is like such and such. All right. So let's say you already know you must know your total energy requirement per day, right? So just chonga only lah. There is a lot of calculation, but you just chonga. What you can see is, let's say you want to live healthier, you must have only 20 to 25 kcal per kg per day. So the kg is actually the body, but it's okay. If you really want to chonga, you can just use your current weight lah. Right, it's not advisable for oldest obese patient or if you are like BMI more than 30, you cannot do that anymore. You must use less. Right. If let's say your BMI more than 30, I would advise 10 to 15. Right, 10 to 15 kcal per kg per day. So there are a lot of apps. You can like My Fitness Pal, then even the Malaysia one, you have Nutri Score. You have this Nutri app. But this Nutri app, you need to pay lah. But that is actually Malaysian government produces the app. So the good thing about that, everything is there. It's actually used by dietitians lah. Right. So that is one more thing. So let's say you take more calorie, that means you must spend more lah. And you spend more, how you spend it, then you do the exercise lah. So you must strike the balance of the calorie. Because it's like very, very, this one like very, very too high-fi or maybe too the fundamental, right? You see, if you do exercise, we actually, the energy expenditure, you can actually divided into 4 types, 4 classification. You have your basal metabolic rate, you have your non-exercise activity thermogenesis, or we call it NEAT. There is a thermic effect of food, TEF, and you have your exercise energy thermogenesis, right? So the blue one is actually how your total energy expenditure for the whole day, right? It's actually your basal metabolic rate though. So exercise is here, your EAT. So exercise is the yellow one, is only 5 to 10%. Right? So if you want to spend more energy, it's actually your basal metabolic rate. So what is basal metabolic rate? That means, let's say now we are all sitting here, we are not doing anything, right? Probably just listening to me, right? So you already achieved your basal metabolic rate. That's all. Because metabolic rate is from your breathing, then your heart pumping, right? Maybe a little bit of sweating, right? All those energy used is your basal metabolic rate. So how do you, and this basal metabolic rate will reduce. It will reduce when you age. When you age more, then your BMI will come down. That's why your energy will be less. And then if you eat the same food as what you eat when you are young, right, you are going to get fat. So when you are old, right, we always say you have an old tummy, right? Old man tummy, right? Your old man tummy is real. It's because actually most of it is for your BMR. And one more thing is your non-exercise thermogenesis is your physical activity. Let's say you're walking and then you're climbing the stairs, and then even though you're writing or you're using a computer, that is your NET. NET also actually, those are the ones that spend the most energy. All right. So this is something like, how come like that one, right? So then the thermic effect of food is what? This is protein. If you take carbs, there's no TEF. Carbs, whatever you eat, the body love it, The body will love it. If you take carbs, simple sugar like it, it will just go in as a fuel. It go in a fuel and then it can access, then become fat straight away. Right? You get absorbed straight away. But if you take fat is different. Fat, you need to spend a little bit of energy to break down the fatty acid to become the glucose back, right? And to store it as fat back, right? If you take fat okay, so that's why fat is will have a little bit of thermic effect, and the best thermic effect is actually protein. That's why I always tekan so much on the protein. If you take protein, actually you might have a negative expenditure. That means you let's say you take 1 gram of protein, to put things in perspective, easier for us to understand. Let's say you take 1 gram of protein, maybe you need to spend like maybe 1.5 gram of energy. Right? So things like that. So that's why it's the food that we eat is the BMR, all right, and also the and the physical activity. So whatever you exercise, how you exercise, is only 5 to 10%. So you spend a lot in gym, is also actually 5 to 10%. But the problem is if you exercise more, actually the caveat is BMR will increase in the long run. No, it's not like today I just do exercise, then tomorrow I go sleep. Then after that, the next gym session is next month. So that one, I tell you, you won't lose weight. You won't lose weight. If you want to lose weight, you have to go gym every day, at least 3 times per week lah. All right, that is how the Ministry of Health, how WHO get this 3 times a week, 30 minutes a time, right? So this thing has been there since ages lah, right? So this is, I think today we just want to remind each other. Yeah. So when you do exercise, it's actually your age, 140, and then you minus your age, then you get the heart rate. Sorry, 220. 220 minus your age. Right, 220 minus your age. Let's say I'm 40 years old. I'm 40 years old. 220 minus your age is 180. So you see, my VO max is 180, right? So this 180, but you must achieve this aerobic 70% of 180. That is your heart rate when you do exercise. It's like you do exercise, nowadays it's very hot, pickleball. Pickleball I hate the most. You know why? So sorry to say. Because pickleball, you won't increase your heart rate, Your heart rate will be like, because the ball is so slow, epa, epa. Okay, pickleball I think is designed for maybe 70 years old. But if you're 70 years old, maybe your heart rate will increase like 105 like that. Right? Then you will have aerobic, you have cardio training. It's endurance only, endurance only. That's all. It's only for your cardio. It's not even lose any weight yet. It's not any negative expenditure yet. Right? So you must come to 80%. So how you do this? You can either wear a smartwatch, right? Wear a smartwatch, right? The smartwatch will tell you lah. Or you can just get your wrist, right? And then this is your radial artery, right? And you count lah. You can just count 30 seconds. Count 30 seconds and times 2 lah. Then that will be your heart rate. You do not need to be like, wow, very, very accurate like that. No lah, no need lah. Yeah? But actually, if your smartwatch, you are wearing your smartwatch when you are going to jog or do whatever exercise, the smartwatch will tell you. Right, nowadays the smartwatch is very cheap only, right? It's on like maybe $100 like that, right? But if you can achieve 100%, that is crazy lah. I don't think you will go here. So usually you will be like 80 to 70%. That is good enough, right? So when you do exercise, that 30 minutes, you just need to have. Then there is another one thing I call HIIT, HIIT, right? That means every 5 minutes, you go and achieve your VO max 80%. Then after that, maybe 20 minutes, then you reduce a little bit, then you become relax a bit. Then after that, you another 5 minutes, you achieve your VO max again. Right? You can increase your VO max only by 2 things. One is the rate. One is how fast you do it, repetition. Let's say just now the one who do let's say you do jogging, you jog your faster, you become faster. Right? Another one is the weight. You increase the weight. Maybe you see like Bruce Lee, right? Last night, Bruce Lee or Jackie Chan, right? They like to put the weight like that. That is actually to increase the VO max. You put weights. And let's say in the treadmill, how you're going to increase more is actually inclination. You just incline. You just incline like maybe 5 degree, or there are some crazy fellas 12 degrees, that one can increase your VO max as well. So all in all will be like sleep is the most important. Second one is the hydration. Then number 3, yes, diet. I didn't really talk about diet right today because I think I spoke a lot about diet already. Then I actually purposely because I saw Jonathan, physiotherapist, so exercise. We will talk about your exercise today. So Okay. Then the last one is exercise lah, and you look at the energy expenditure as well. Right. So if you guys, this is actually for, I don't know if there's any medical doctors here lah. If there are medical doctors, we are having a Mugis in October. Right. So this is actually for medical personnel lah. Mugis is Malaysian Upper GI Society. So we'll be talk a lot about upper GI, and we'll also touch about bariatric. Right. But this is for doctors lah. All right. Okay. So any question?
Okay, if there are any question, please type your question or just talk over the Zoom here. There are some questions here in the chat box. May I know where we can check our BIA, any center in PJ or hospital?
The thing is, if you have money or not have no money. If you want to pay money or don't want to pay money. Okay. If you want to pay money, anywhere. All right. Any gym you can get. But the thing is, the machine, the machine you must be validated machine. The machine that I use is in-body, right? In-body machine. Another one is SECA. SECA, SECA. SECA also can use. Tanita, okay lah, but not as good. All right. And don't go for all those whatever branded one. I'm not really this one. There's a new one, the China one, not China, Taiwan one. There's a Chadder. Chadder also quite accurate. Why we need to, the thing is, if you like Xiaomi, right? You have Xiaomi, the uh,
The line is bad.
the portable one, right? It's not accurate. Right? My internet is not good. Hello? Sorry, my internet is not good. What was that, Jen?
No, I say your line is broken.
Yeah,
What did
yeah.
you? Yeah, you were talking about Xiaomi, and after that we lost you.
Oh, then I mean, don't go for Xiaomi. Then all those portable one, because all those portable is only your leg and leg. That one is what we call is only a 4 point. 1, 2, 3, 4. The 1, 2, 3, 4. There's another one with the hand and the leg. Right. So there is 8 points. 8 points is what the standard lah. Alright. So government hospital, sadly to say, government hospital they don't have, but government clinic kesihatan should have. It's very weird. It's politics. So I don't want to go there. So clinic kesihatan have it, hospital doesn't have it. Alright. So I trying to get for my hospital as well, actually. Right.
Okay. Jonathan asked, so basically in-body seems more reliable compared to other brands.
Because they are the one who started first, and their database is a lot. You must see, actually, one is not only the accuracy of the readings, it's also they can compare. They can compare with you and the other population. And in-body has been around since like ages. They are one of the first company who do it, and their database is a lot. So that's why, and if you want to do any research, it's in-body and SECA. So in medical field lah, right? So that's why we, as a medical professional, we try to use this kind of measurement so that actually I can do research as well. So that's the thing. Xiaomi, I'm not really sure lah, but the Xiaomi I've been using, but it's not accurate.
Okay.
It actually reassure you your body fat is not high, but actually when you do in the body, your body fat is like damn high. That's my experience with Xiaomi. Sorry.
Yeah, different
Yeah.
weighing scale give us different reading. Yeah.
Yeah, Jane, one thing is it's good, but the problem is I would like to highlight this. BIA is not weighing scale.
Oh, yeah, okay.
BIA is
Noted.
not a weighing scale.
It's
BIA is a
it's
body
quite
composition.
big. Okay.
Yeah. It is want to look at your fat mass and muscle mass. It doesn't, they got maybe a little bit to do if you're overweight, but it's not a win scale.
Okay, the line is bad again. Okay, in that case, I have a question for Jonathan. Oh,
It's the problem with KKM because when I want to ask
okay.
for the asset, right? Because yeah.
Oh, we lost. We lost Dr. Ngo. Oh, Dr.
Sorry,
Ngo
I
is back.
something wrong with my internet today. Yeah.
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 Okay. So, to conclude, I think you are trying to say, the conclusion BIA is not the same as weighing machine, the scale.
Yeah. Yeah.
Okay. Okay. Anyone with more question? I actually have one question for Jonathan. Is there, I always confused with physiotherapists and chiro what
Chiropractic.
chiropractor. Yeah. So how to know when to use who?
This is what we get a lot lah. Physio versus chiro, right? And the confusion
Yeah.
going on. Basically physio we assess movement and we are more treating towards the muscle, nerve and all that, right? For chiro they are more towards alignment of the spine. Yeah, so they are very focused on spinal alignment, whereas for physio we are treating too many things.
Okay.
Because we cover so many things, right? Yeah, so that is the difference lah. Uh,
Okay.
mm.
Okay. And then also there's another field called bone setting.
Bone setting,
Are
yeah.
they the
So,
same?
so a lot of Chinese seafood they will call themselves bone setters lah. So basically, something it looks like chiropractor, but I think they have different principles behind their practice. Yeah.
Okay.
So bone setters most likely is traditional type of medicine. Yeah.
Okay. All right. Thank you. Okay. Anyone else with question? I think the metabolic syndrome is something for us to take note of. Yeah, that one is the root cause for a lot of disease. So what Dr. Ngo shared today is really good. I think just simple habit, if we consistently practice it, it will help us to avoid a lot of issues later part of the of our life. Yeah. Okay. If there's no question, then we will end our session today. And I would like to thanks Jonathan and Dr. Ngo so much for spending close to 1.5 hours here to share us the insight. Thank you so much, Dr. Ngo and Jonathan. Dong Hui, you have something to say?
Yeah, just thank you, Jonathan. Thank you, all.
Yeah. All right. So we hope to invite you all again next time.
Yeah.
Yeah. Our crowd, the most of the scholars here I believe are the younger ones. But I hope they will start to take note of their health when during their young age. Yeah. Hopefully we can get to invite you all again for the next fun talks. All right. Thank you. And have a good day. Bye.
Yeah.
Have a
Bye-bye.
good night.
Thank you.
Bye.
Bye bye.
Bye.